Greetings, YouTube. Once again, healthcare is on my mind. As you know, in America, we have a new healthcare bill which is slowly being phased in. It won't be finished until, I believe, 2019, when the last part of it will finally go into power. And the Republican Party, lots and lots of them, are talking about repealing this law to get themselves elected come November 2nd. There are probably conservative Democrats doing the same thing, and of course the Tea Party candidates as well. Well, a recent study was done, a poll was taken, and in that poll, the number of people that thought that the current law did not go far enough outnumber the people that think that the U.S. government should stay out of healthcare 2 to 1. That means twice as many people think the law should have gone farther than it did than the people who think the law should have never gone into effect. Those are some significant numbers, people. Some real numbers. These are not numbers that can just be dismissed with a hand wave and, oh, that's just grumbling, whining people. No. This is a majority of people. They think that the law should have gone further. The least it should have had was a public option, allowing people who are uninsured to have a public co-op, basically, option of joining themselves together to be able to get good deals from insurance company. What it really should have had was a single payer system like every other industrialized nation on the planet. And that scared people because the conservatives put forth the idea that it was socialized medicine, but it's not socialized medicine. But again, of course, we already have socialized medicine, if you want to look at it that way, in the form of Medicare and the U.S. military. And, of course, all the Congress critters have health care paid for by the U.S. government. But they don't want you to have it. It's okay for them to have it, but not you. But a single-payer system would have been the best way to go. But, of course, it was shot down, as was the public option, and which is also sad. And I've heard a number of arguments. Just last night on the way to work, I heard a French expert talking about the French economy, and he mentions that the healthcare system in France is paid for by tax dollars, deducted from payrolls. So payroll taxes go into this fund, and it pays for the healthcare for the French people. And 10 seconds later, he says that because of potential cuts, that the French people are upset because they've been getting a free lunch on healthcare. They haven't been getting a free lunch on healthcare. They've been paying for it out of their paychecks, just like every other person should be doing, say, in the U.S. Just like I pay for cops and the fire department and Coast Guard and the military. So I'm not too happy about that. And everything else that gets paid for with federal tax dollars. And all those people get paid, they make a living, just like you do, but they just get paid from my tax dollars, and I'm okay with that. They give me services. I give them money. It's capitalism. But I've actually heard a conservative tell me that he felt that if you made doctors, that's how he said it, made doctors serve the public interests, that would be tantamount to slavery. Just like all the firemen and police men in the world, I guess, because all of them are slaves as well, because they get paid by the public. And that kind of thinking just confuses me. The cognitive dissonance involved in that is just astounding. It's okay to pay for all these other services that people pay, that people accept without thought, without concern. But if you say healthcare, suddenly people get up in arms. And I don't understand that. And then there's, of course, the whole concept in America that it's a for-profit business, which is immoral, and it's put forth as the idea that it's a privilege, that having healthcare is somehow a privilege. It's not a privilege, folks. It's a basic human right. Saying that everyone doesn't deserve healthcare is a lot like I hear a conservative voice could say, well, you know, starving people don't deserve lobster thermidor and baked Alaska. You know, you're right. No one deserves lobster thermidor and baked Alaska. But you know what starving people do deserve? Not to be starving. And everyone in America, the most powerful nation on earth, possibly the most powerful nation in the history of nations, doesn't make sure that every single American citizen has health care. 18,000 of us a year die in America because we don't have health care. All right? 18,000 people. How big's your town? What percentage of that is that of the city you live in? Are you willing to accept that? Are you willing just to, like, close your eyes and walk away? Because it isn't just strangers that live way over there that are having this happen to them. It's people that live in your community right now. By next year, maybe one or two of them will be dead because they didn't have health care. So, come November, don't vote for a conservative. And you're going to hear this theme again in some of my videos, because I'm going to be hammering this point home like a mallet on a tent stake. Voting for conservatives is the worst possible thing you can do for the American people. And the next time a conservative tells you that we have the best healthcare system in the world, you laugh at them. We have the most expensive healthcare system in the world. They'd be correct in that manner. But we have one of the lowest life expectancy rates in all of the industrialized nation. And 18,000 of us a year die because they can't access the privilege of healthcare in America. Healthcare isn't a privilege, folks. It's a basic human right. We all deserve access to it. Every one of us. Even the conservatives.